Let's see. And I apologize for everyone if I misspelled anything on the agenda. I just kind of threw it all together really quick. It's been a little crazy. And unfortunately, we didn't have much time to put our agenda out there or our meeting. Things have been rapidly changing, and so I'm not sure we could have a full meeting tonight, or, there could be 10 of us. But either way, I'm really excited to hear what everyone has to say. My name is Margaret. I'm the chair of the Whitaker Community Council. So, Briandra, are you ready to start recording?
Yeah, it's recording.
Fantastic. So, everybody, welcome to our general meeting. It is February 12th. This is the Whitaker Community Council meeting. We do record the meeting and then post it on our YouTube channel afterwards. So if everyone's okay with that, great. Doriandra's going to start recording us right now.
It's good.
Okay, fantastic. So I don't know how many of y'all are familiar with Google Meets. We had Zoom for a while, and because we are a recognized neighborhood association, a couple of things. Hi, Jen. There are a couple of things that the city pays for, and this is one of them. So they got a bargain to go to Google Meets for all the neighborhood associations. They provide this. So if you have a question, you can see down at the bottom of the screen, you can raise your hand. And if you just push the little button, you can see it says Whitaker Community Council under my name, or you can feel free to just raise your hand as well. And there's also a chat on the right-hand side. If you look, and you'll see it's just like a little instant message box. What we're going to ask is during people's presentations, if some questions come to mind, they may answer them before we get to the end. But please feel free to put them in the message, and then we will do a little Q&A at the end of everyone's presentation, and Julie's going to take care of that. So my name's Margaret. I'm the chair of the Whitaker Community Council. Why don't we start with Derek? And Derek, you introduce yourself.
Hi, I'm Derek David. Own a business, Jerry and Waltz, right on First and Van Buren in Eugene. We've been there 11 years this year.
And who are you, Derek? You're an
member,
at-large
member,
board member. Yeah.
Yep.
Fantastic. Amanda, you want to go? Do you guys see? So I see Amanda next to Derek. Does it look the same to everyone? Fantastic. Oh, it doesn't, Stephen?
No.
All right. So Amanda, why don't you go ahead and introduce yourself?
Sure. So I'm Amanda McCluskey from HID Alliance, here to present. I'm part of River Road neighborhood, but not this neighborhood.
Jules?
Sorry, I went looking for a link. Hi all, I'm Julie Bowman. I am the Whitaker Community Council Secretary and a Whitaker resident for a long time now, and I'm the person primarily responsible for the music in the park, Scobert Gardens Park. So if you like it, tell me about it, and if you don't, tell someone, not me. We're excited to have our second year of Art in the Parks funding this year. It's going to be a really good series. I'm glad y'all are here.
Fantastic. Doriandra?
Hi all, I'm Doriandra Smith. I am the executive director for the Whitaker Community Council, And I'm really grateful we have so many new voices in the room tonight to help us through these interesting times with some valuable resources. So thank you.
Stephen?
Can you hear me?
Mhm.
I'm Stephen. I live on North Polk, and I'm an occasional volunteer on, particularly on historical stuff and stuff that requires sitting at tables or judging cooking contests. So whatever's fun, I volunteer for.
We're lucky to have you there, Stephen. SLD, would you like to introduce yourself? Okay. Cynthia?
Hi, can you guys hear me?
Yes.
Sorry, my camera's not on, but it tells me it's not working, so I don't really get it. Mark and I live here on Fifth Avenue, and we've only been here for about 4 or 5 months, and we're just interested in making our neighborhood even better.
Fantastic. Are you and Mark both at the meeting?
Yes, Mark is right here. Say hi, Mark.
And will I ask, just because Julie is going to ask for attendance? We're
Right.
going to talk about that in a minute, so we just want to make sure that we get Mark's name as well.
Yep, we're here.
Fantastic. And anyone else that hasn't introduced yourselves?
Oh, Susan is SLD. Susan, you're muted. I'll text her and tell her that she's muted.
Thank you.
Okay, are you hearing me now?
Yes. Hi,
Yes.
Susan.
Hi, I haven't done this on my phone, so trying to find the right buttons. Cindy and I live directly across from each other on Fifth Street. So we're neighbors.
Yep.
And we're at Fifth near Tyler, between Van Buren and Tyler. Hi.
Hi. And anyone else who hasn't introduced themselves?
Oh,
can
I'm on
go.
the call. It's Chris Horton. I'm an at-large board member. I live on North Grand Street.
I think Marley.
Yeah, hi, I'm Marley. I'm the Development and Outreach Director for Transponder, and I'll be presenting about us a little bit in a bit here.
Great.
Fantastic. Do we have anyone else?
Do you want just regular folks like myself to introduce ourselves?
Yeah.
Okay.
We're all introducing ourselves to each other. This is, we're trying to make it kind of a town hall kind of thing.
Great. I'm Jen Schock. This is my partner, Christian Kaufman, who is listening and eating. I am the development director of Burrito Brigade, and I also help run the Whitaker Community Market. I live just outside the neighborhood boundary, but the Whitaker is my neighborhood. I'm on 8th and Chambers, so very close. I also am on the board of the Upper Willamette Soil and Water Conservation District and probably some other stuff. And I participate pretty regularly in the Public Safety Committee meetings for the council.
Correct. And you are a local business owner through the market, so that's great. Okay, are we missing anyone? So pardon me if I pronounce it wrong. Is it Latif?
Oh, it's Latife, Margaret. I think she's trying to get back on. So
Okay,
I'll
I see it shows that she's on in the chat, but what's up, Julie?
yeah.
Real quick, Margaret, I did manage to find the link for the Google Forms thing that we're using to track attendance. So, my friends, if you live, work, or own property in the Whitaker and you would like to have your attendance recorded for lots of reasons like gold stars, but also because we're going to have election in April. Please go to the chat and look for that form link that I just sent, or comment, I guess, and I'll try to get it to you directly. Google Meets is not as easy as Zoom was for sending things to individuals, but I'm trying to track everyone's attendance right now.
Thanks.
Hi, everybody. Sorry it took me a minute to get onto my computer because I don't know Google Meets as well as I do other things. Hi, my name is Leticia Amado. I am Chris's wife. I also work for Lane County, but today I'm just here as myself to offer information from an individual organizer sort of stands, but I do work for the county as the Chief Equity Officer.
Fantastic. Welcome, and thank you so much for coming. Real quick, do we have any public comment?
What do you mean by public comment? Sorry.
Public comment is just at the beginning of the meeting. If somebody wants to share something, or if they just have a general question, that's what public comment is for. Or if you have a concern, maybe next month you'd like to see something different at a meeting.
Can I just briefly share a concern?
Sure.
I have never seen such hideous alleys anywhere in my whole life, and I don't really get what's going on. I called the city and they don't fill potholes, and I just think we need to make this area as beautiful as possible, and I think cars should be able to drive through alleys. So I have a couple ideas about what we could do, but so that's my concern right now, one of them.
Fantastic. And so how about if you reach out to me, send me an email, just send it to whitakercommunitycouncil@gmail.com, and we'll talk about what we can do to help with that.
Okay, great. Thanks.
Thank you. Okay, so let's we're gonna start the meeting with our community organizer. If I could ask for everyone to put yourself on mute. If you have a question during the presentation, please put it in the chat, and then we will address it at the end.
Was that a prompt for me, Margaret? Wonderful. Yeah, so I'm going to keep this pretty brief. I think I was requested to just share some information on what is the most useful and helpful thing in order to be supportive to our immigrant, refugee, and undocumented community here in Lane County. You have probably seen a lot of information as to all the different ways that you can be an advocate, and I want to just sort of offer the best best ways for you to do that. So one of the ways is to know your rights, both you as an ally, not necessarily as an undocumented person. ICE is not going to come knocking at your door. However, if you do choose to interfere and show up to be an ally from a place of being documented and having that privilege, making sure that you know your rights. And I'm happy to share resources with Margaret so that she can share with folks. But knowing your own individual rights, and also for your neighbors to know your rights, there are lots of different resources. You probably have seen the little red cards that you can print out and distribute as well. They come in various languages, and these are individual cards that people can have in the event that ICE does come into your private property, into your home, or places of that nature. In addition to that, there's other rights that people need to know about. So for example, Oregon being a sanctuary state, and what that means and what it doesn't mean. It doesn't mean that ICE can't operate in Oregon. It does, and it will, and it has. But more importantly, to know that public agencies are not supposed to be collaborating with ICE. So information sharing, and that goes for any public agency. If you are a government agency, you cannot be collaborating with ICE. That is what state law sort of implies. So making sure that people know that, and if you suspect or somebody suspects that their rights have been violated, there is a sanctuary hotline that people can call, and the state can investigate and give you that report back so that you yourself can take civil action against any agency that was found to be collaborating with immigration agents. I I will tell you one thing that is not useful. I think people do this often to want to support their neighbors, but posting on social media unverified accounts of ICE agents or ICE raids, that is not helpful. All it does, it continues to incite fear in communities and makes people not get out of their houses to get just their individual needs, whether go to the grocery store, to their schools, or just operating. There is a rapid response hotline. And again, I can share that number with Margaret, but this is an Oregon rapid response line that if you do suspect that there are any sort of ICE agents or you want to communicate that, you can call that and they will do all the verification needed before informing communities. I think the most important thing to remember is that these people are our neighbors, right? And just like you would, this is the opportunity to show up to just be a good neighbor. You know, if you're going to the supermarket, be like, hey, I'm going to the supermarket. Can I get you anything? People are living in fear. And some of the things that we take for granted, like going to the supermarket to get, you know, eggs because we're one egg short of our, you know, for the baking thing that we're going to do, becomes really difficult. And just any ways that you can find to be a good neighbor are really, really helpful. Another thing that you can do, there are lots of organizers that are distributing information. So there's a lot of flyering events that are just letting people know what their rights are. There are protests that are, you know, sort of being organized around the community. So feel free to attend those. Let's see. The last thing I will share is that there were also, you know, I actually heard today that the ICE facility, our closest one is in Washington, is actually full. So ICE has absolutely been ramping up their efforts here in the Pacific Northwest. So they are officially out of beds for housing individuals. So happy to answer any questions that you might have.
I have a question.
Sure.
So I know I've talked to the city. I know that the Eugene Police Department has said that they will not participate. Have you heard anything? Do you know what the sheriffs have said? Because I've heard nothing about Lane County Sheriff's Office.
Yeah, there hasn't been any official press release, but we did have if you can actually look it up, there's a public meeting that happened. It was a week before inauguration. Let's see. January 8th. So you can watch that public meeting where the Sheriff's Department presents alongside the Oregon Department of Justice, and they talk about all of the procedures to continue to operate. And again, I'm not able to speak on behalf of the county, but I can point you to the resources where you can see those statements and what was made. So January 8th, if you just go on YouTube and look for Lane County Board of County Commissioners meeting from that date, you're able to get that information.
Fantastic. All right. Thank you very much. Does anyone else have any questions? Doriandra?
Yeah, I have two, and thank you for your presentation. Do you know, like, how many beds does that facility have? I mean, how many are we talking about in terms of already that have been taken out of our communities? And then the second one was just, it was interesting to see recently on the news that Coos Bay Sheriff Department or the commission voted to uphold state law instead of federal, which was kind of a shock because that area is so specifically geared in one way. So I just wondered, it seems like across the board, we're seeing a lot of that good, or that decision making. Do you feel like that's going to really be the prevalent wind here in our state?
Yeah, I mean, that's a good question. So the Northwest Detention Center has capacity for almost 1,600 individuals. So that's the number. I don't know the numbers prior to, but I do know that they are full. In terms of Coos Bay, so Coos Bay did have an item on their agenda last week to vote on enforcing what they call, what is it? There is a piece in the Constitution and it'll come to me probably by the time I'm done talking. But the Coos Bay Board of County Commissioners opted to not vote. So they voted 3-1 to ensure that Coos Bay continues to be a sanctuary county. But we are seeing this across the board. I mean, even in California, Southern California voted Huntington's, what is the city, Chris?
Huntington Beach.
Thank you.
Huntington Beach.
Yep, voted to not be a sanctuary city in a sanctuary state. So I imagine we will see these things pop up. Coos Bay luckily voted to not do that. And I don't imagine in our areas we will see a lot of that, but I can imagine in some other, particularly rural cities, rural areas, like getting these ideas, and because they have a favorable board towards that, we'll go in that direction.
Is Coos Bay Douglas County?
Yeah,
Is
Coos
it part of
County.
Douglas?
Coos County.
Oh, okay.
Yeah, I think it's west of Douglas. Are there any other questions? Well, thank you, Julie. I mean, I think this is a really important subject, so.
I was like, what was my question? I did have one. Latifah, so I keep seeing on social media things that say, hey, as a white person with citizenship, here are some things that you can do to perhaps inform other people of their rights, or otherwise resist or, cause things to be problematic in ways that aren't likely to get you harmed or arrested. Have you seen these things? Is any of that true, or is that good advice?
Absolutely. And I'll share, like I said, I'll share with Margaret that knowing your rights, like you absolutely can interfere. And it is, every individual needs to do that risk assessment, right? What are you willing, how far are you willing to go in terms of resisting? But some of the case studies that are not necessarily local, but across the country, is that when people do interfere, like ICE just goes away and goes on to the next people. So I think that all of these acts of resistance can absolutely be beneficial and helpful, but every individual has to really assess their risk. And, it's not just privilege of citizenship, but also economic privilege, right? If you do get arrested and you're away from work for a couple of days, can you afford to do that? Can you afford to have an attorney, right? You have a pretty good chance of getting out of that messiness, but you have to be, sort of know how much risk you're willing to take and how much privilege you have to be able to do that.
Hey, that's a great answer. Thank you.
Yeah.
I appreciate that.
Do we have any other questions? Well, again, thank you so much, and I know that this is just the tip of the iceberg. We're just beginning to see what's going to happen, and I know that the best way for us to get through it is for us to just come together and get through it together.
Yeah.
So
one recommendation is there is a coalition. It's called Oregon for All. You're welcome to check it out. There's a lot of nonprofits that are signing up, and it is a coalition in protection of immigrant rights, but not just the Latino community, but all immigrants, including Muslims that are a big target of hate crimes in the community. So that might be something for you all to consider as your nonprofit, to sign the coalition and join in support of the work that they're doing.
fantastic. Did you get that, Doriandra? Thank you very much. All right. Again, thank you very much.
Absolutely. I'm going to go put our babies to sleep.
Okay. We'll see you
Thank
again, I'm
you.
sure. So next we have HIV Alliance. Amanda McCluskey is here. Renee, I think, is unfortunately several people are not feeling really well. So Amanda has stepped in to speak for her. So Amanda, please take the floor.
All right. Is it all right if I share slides?
Sure.
Okay. Let's see if I can. Y'all can see that okay? Oh yeah. Great. All right. Sorry, one sec. Just moving everything around. Okay, great. So I'm Amanda McCluskey. I am the Senior Program Director at HIV Alliance. I've been there for just about 18 years altogether, and I've had a lot of different roles there over the years. And I presented to Whitaker Community Council a couple of times, but not since COVID, so it's been a minute. We were founded in 1994, and our mission is to support individuals living with HIV and prevent new infections. So everything we do falls under that umbrella. Our main office is in Lane County, but we serve 15 counties altogether. The variety of services. We have 6 different offices and about 150 staff at this point. Let's see. Oh, right. So our services fall into a couple of categories. We have our client services department, which is under the supporting people living with HIV umbrella. So this is for folks living with HIV. We also have a case management program for folks living with Hep C. It's a lot smaller though. But our HIV care program serves 15 counties in Oregon. We have, and I'll tell you more about it when we get there, but we have a behavioral health program and a primary care program. So I oversee our clinical programs. So that includes our behavioral health and our medical care. And we have a supportive housing program for people living with HIV. And then we do a lot of prevention work, and we have some outreach that we do, street outreach in Lane County that we do as well. So our client services department, this is what supports people living with HIV. This is funded by the Ryan White CARE Act. That was legislation that was passed in 1990. So it's been around for a little while. And that funds care for people living with HIV across the country in a variety of different ways. So a large portion of our funding comes from that and is to support that program. So we do case management. We are focused on making sure folks have access to medical care and medication. Just over 90% of our clients who are living with HIV are what's considered suppressed, which means that there's so little virus in their body that it doesn't show up on a test. They're, of course, still living with HIV, but once a person reaches suppressed status, they're not able to transmit the virus to anyone else. So it's a really important piece of the work. And it also means that folks don't experience as many negative health outcomes of HIV. So our clients, when we first started, we were a hospice, and now our folks, we lose a couple of clients a year, and it's usually to the same things that everybody else dies of, like heart disease and cancer and things like that. So the disease has really, really changed. We have nurses that work with folks. We have a pharmacy adherence program to help folks navigate like side effects or issues with their medication. The pharmacy program also offers technical assistance to medical providers across the state. And then we have a supportive housing program specifically for people living with HIV. And then a handful of other services that you can see there too. So it's a very robust program. So next I'll tell you about our medical clinic. So in Lane County, we have a medical clinic. We accept Medicaid and Medicare and most private insurance. We have 2 medical providers. These are our providers here. It's Leah Jo Figueroa Carnine on the left and Caitlin Meyer on the right. And they do all sorts of things. They do primary care. We are accepting primary care patients now. Oh, my lights are on a timer and they're starting to turn off. So I'll see if I can multitask. There we go. We do HIV primary care. We do medication assisted treatment, so Suboxone, gender affirming care, PrEP prescribing. So PrEP is pre-exposure prophylaxis, so a medication that folks can take if they do not have HIV. They take this medication. If they come in contact with HIV, then they don't become HIV positive. So that's a pretty important program that we have. We also do a lot of vaccines and STI testing. We do a lot of hepatitis C treatment. We treat primarily folks who are unhoused, struggling with substance use disorder and other things that can be barriers to care, but we've had a lot of success of even getting folks who are, in those sorts of difficult places through hepatitis C treatment and clearing the virus. So it's really exciting. We're really, really proud of that program. We have some same day visits. And like I said, we're currently accepting patients. So that's in our office in City View. We also have some street outreach that sometimes goes along with our medical care. So we have some street outreach we do in the urban and rural areas. We have some housing programs that our street outreach specialists can refer people into. They're pretty limited, but we've had some really great success there. We are opening a safe sleep site currently. It's called Rainbow Corner. We'll be taking referrals from our LGBT peer support specialist, which I'll tell you more about in a minute, and from our HIV case management program. And the site is there on the corner of River Road and Northwest Expressway. So right behind the adult bookstore, right by the community support shelters across the street from them. And it's a microsite, so it'll be 6 people, but we're like this close to getting that open. We also have some community health workers. So we have our hepatitis C case manager that's in our clinic. And then we have some community health workers that work specifically with, oh, I'm so sorry, my dog, with BIPOC populations that are housed at the MIMS house with the NAACP. And then we also just started a contingency management program. It's kind of jargony, but it's basically a low barrier stimulant use reduction program where folks take a urine drug test and it shows negative for stimulants, they get a gift card. And we've seen a ton of success and engagement with that program. Folks doing that and then working on other goals, after they've been able to maintain a little bit of sobriety or reduced use. So that's been really exciting too. We have a drop-in space in our Eugene office. So we call it our patio, but it's sort of the one side of our building. And then these are some of the staff that work in the patio space. But we have drop-in services Monday, Tuesday, Friday from 10 to 2. We have food and water, sometimes clothes, some survival supplies. We do syringe exchange. We give out a lot of naloxone. So if folks need naloxone, patio drop-in is a great place to get that. We give out probably between 800 to 1,000 doses a month in Lane County. So it's quite robust. We do that primarily at syringe exchange. And then we have some rapid HIV, syphilis, and hepatitis C testing in the patio space, as well as chlamydia and gonorrhea testing. And then it's sort of a low barrier access point to connect to our other programs. We also have a behavioral health program. So this program serves Lane and a couple of other counties, and we accept Oregon Health Plan. These are our 4 therapists. These folks have a lot of expertise on working with LGBT populations, and then other folks living with or at risk for HIV, and then also experience with things like trauma and other stuff too. And then also under our behavioral health program, we have peer support services. So through Metro 110 and then also through another funding source, we have peers in Lane, Marion, Washington, Douglas, Josephine, Jackson, and Coos counties. So our peer support program, we have 2 funding sources, Prime and Measure 110, but our peers are unique in that they are not attached to a treatment program. A lot of other peers are. So for our peers, we're working with folks who are building readiness to access drug treatment. And then also we work with them to meet their health goals, their housing goals, their treatment goals, whatever it is the person wants to work on. That's what we work with them on. And we have peers that work with anyone with substance use disorder. And then we have a peer that's focused on the LGBT population and then also a bilingual peer. So, and then one thing that we added in the last year is an employment program. So we have peer support specialists in this program that work with our syringe exchange clients to help them build employment readiness skills. And that's been a really exciting program. It's been really great to watch folks building their skills and working on getting jobs, and in some cases getting jobs. So next, I was going to talk about our prevention department. So our prevention team is really focused on preventing new infections. So we have rapid testing. We have HIV, hepatitis C, and syphilis rapid tests. And then those are, they take about 20 minutes to process, so folks can get those results right away. We do outreach, so we do a lot of online and in-person outreach. And a lot of that is around getting folks to come in and get tested, and then also to talk to folks about PrEP. So we want anyone who's at risk for HIV to know about PrEP. So that's that medication I mentioned that you can take so that if you do come in contact with HIV, you don't transmit the virus. Oh, and then of course we do syringe exchange. So we've been doing syringe exchange since 1999. And we, gosh, how many syringes do we exchange? We exchange around 500,000 syringes a year. We dispose of them. We give out a lot of naloxone, like I mentioned, and then sometimes we have fentanyl testing strips too, which are really helpful. We give folks sharps containers, and then we bring as many services out to exchange as we can. Okay, so this slide just has a little bit of information about syringe exchange programs. One of the questions that you sometimes get around syringe exchange is, does this increase drug use or increase crime? And the studies show that it doesn't. And we do find it's a really great engagement point with folks. A lot of folks who come to exchange are interested in meeting, building readiness to treatment, meeting their healthcare goals. So we really try to have low barrier services where we can build trust with the person and then help them work toward whatever that next goal is for them. Okay. Like I said, we give out a lot of naloxone. So right now we're doing primarily the injectable kits, which is what this picture is. This is a picture of our injectable kits. We're really lucky in that we're able to get those at a very low cost, so we can give out quite a bit of that. So, and then I think this might be my last slide, but one of the things I want to tell you about too is we just opened a queer resource center in out in River Road neighborhood. So this is on Maxwell. And we are there with Transponder and Queer Eugene and a couple of other people too. That just opened, and we have a website. We're doing different activities and events there, and there'll be more to come there too. And then if you're interested in supporting us, there's ways to donate, volunteer. We're always looking for volunteers. I started as a volunteer in syringe exchange, and it got me hooked, and I never left. So syringe exchange is one of the most, I personally find it to be one of the most fun and rewarding services that we do. It's really fun. Yeah, and you can share our social media content. And if you know anybody who's looking for a therapist or a primary care physician, feel free to also share information. We are taking new patients. So I thought I saw there might have been a question in the chat. I can stop sharing. Do I have time for questions?
Sure. Yeah, we actually, unfortunately, I got an email from Women's Space, which is now Hope and Safety Alliance, and she is very sick today. So it freed up a little bit of room for us. Actually, I put the question in the chat, Amanda.
Okay.
And I'm just curious how much of your, if you know how much of the budget that you have now is from federal funding.
Yeah, I think I think it's around 60%. We only have one direct federal funding award, but we have several different contracts that go from the feds to the state and then to us. So yeah, I think it's around 60 to 70%.
That's a lot.
Yeah.
Let's do a great. I mean, I've been, like I said, I've been familiar with HIV Alliance for a long time, and I've been in Eugene a long time, and
Yeah.
you do fantastic work and more. I mean, I'm had no idea you were opening a safe sleep site, and
Yeah.
and all of that. I mean, that's fantastic news. I'm sorry, Julie, you have a question?
Yeah, well, kind of a question or comment. I really appreciate, Amanda, the HIV Alliance doing needle exchange. I think that is a really valuable service, both for the help of people who are addicted or using IV drug needles, but also for the community, because it's motivating people to hopefully dispose of their needles appropriately and not leave them out. Do y'all do also the Sharps drop boxes, or is that a separate organization?
Oh yeah, thank you for mentioning that. That is us. So we do have the Sharps boxes that you see around the community, and our team goes out and services those. And I did forget to mention that our syringe exchange is a 1-for-1 exchange. So folks, we exchange, we give them the amount that they bring to us, and then we have safer injection kits that are smaller if someone doesn't have any. But that helps to incentivize folks holding on to those syringes and bringing them back to us instead of dropping them in unsafe places.
I see so many lids.
You see a lot of little orange lids.
I know how to deal with Sharps, and I'm okay. But when I see the lids and no Sharps, then I think, oh wow. So every lid is an uncapped needle. So anyway, thank you for what you do, and I appreciate it so much.
If it makes you feel any better, if they left the cap, they probably kept the syringe and threw it into one of the Sharps containers we give them and brought it back to us. So that would be my guess. So yeah, but thank you. Yeah, I appreciate that.
Do we have any other questions, comments? Briandra?
Yeah, one for Amanda. I mean, this might be it is a global question, but in some of these cuts now for HIV medication in other places, sorry, my dog. Is this just, I mean, I read the other day that 20 million people now in parts of Africa will not be able to have that medication continued. Well, could this just set off like a whole resurgence of this illness?
Yeah, absolutely. I think, like I mentioned, when folks are on the medication, it suppresses the amount of virus that's in their body and makes it, if they're suppressed, impossible to transmit the virus. So if people are unsuppressed, then they have a lot of the virus in their body, which makes them more contagious. It's still, the spread of HIV is limited to some really specific activities. It has to be one of the particular fluids, and there has to be a port of entry. So it's not just casual contact. But that said, the more people who are unsuppressed, the more likely that the disease will spread, for sure. Yeah.
Do we have any other questions? I do have one more, and I'm curious. So I know in the Whitaker that you had a needle exchange location for years where people could go and take their needles, and they knew they could, and they exchanged them, and now that is no longer there. That's correct, right? It's no longer in the Whitaker. And it has, I'm just wondering what we could do. I know that you guys also you're still in shelter care, right?
Yeah.
Because it has made a huge difference on our streets and our parks, as Julie said. And when you guys stopped doing that, it made a huge difference in our neighborhood.
Yeah,
because people don't always feel safe to go and dispose of them somewhere.
Yeah, absolutely. That we were at the dead end of Blair
Mhm.
for 20 years, something like that, for a very long time, 15 years maybe, on Mondays and Wednesdays. We had some pushback from a couple of business owners to the point that we felt like we couldn't continue in that spot. And then we worked a lot with Whitaker Community Council to move to a different location, I think, where you'll have the market. We were there for a little while, and then we've been at the shelter care location since. And we actually it's been slower than when we were at Blair, so we cut that back to just Mondays, I believe. I would love it if we get back to the dead end of Blair, but I think we would probably need some community support on that. So I mean, I think that's something we would love to work together on, and I can get you in contact with our director of care. I mean, prevention director. And we would love to get back there, but it just stopped working.
So you do needle exchange at shelter care?
Yeah, every Monday from 6 to 7:30.
Okay, and you hand out sharps containers. So are you giving away the box? Are you doing like just the little sharp start? What?
We give
You
out 1 quart sharps containers, like a
Yep,
Mason
I know what a
Dixon.
quart sharps container is.
Yeah.
Okay.
Yeah, we give those out, and then also if folks want a 5-gallon or whatever, we'll give those out too. So
Okay, fantastic. Thank you very much.
thank you for having me.
Do we have any other questions?
Just a
Amanda, thank you.
Amanda.
Yes,
Thank
thank
you.
you so much for coming, and you're welcome to stay if you want and finish the rest of the meeting, or you can feel free to go enjoy the rest of your evening, whatever works best for you.
Great. Well, thank you. It was nice to see you all.
Thank you very much. So as I said, the Hope and Safety Alliance, which used to be Women's Space, unfortunately, I got an email from them and they are sick. So along with half of our neighborhood. So we are going to jump right over, and I saw that you were here, Cindy. Yes. Did I see that you signed in early?
Cindy was
Cindy-
here.
Cindy Kohler. Yes.
She's still here.
Is she?
Yeah, that's what it says. Hey, Cindy, we're moving you up in the order. We're not. She's still signed in, but maybe she stepped away.
I can see her video, but we can't hear her.
No, we can't hear you.
I can hear Cindy. I can't see her, but I can hear her.
I can't.
I don't see her or hear her.
I see her in the on the people list.
I had her for a second, voice-wise, but I guess maybe not. There she is. No, Cindy, now I can see you but not hear you, and closed captions don't pick you up either.
Oh, I see you now. No, I can't hear you. See, we love Google Meet so much, especially now that we have the Gulf of America. I'm sorry, I just couldn't help myself.
Okay, so Marley has the suggestion that if AirPods are being used, Cindy, that won't work with Google Meets.
No. So how about you sign out and sign back in? Thank you, Marley.
Technology is awesome until it is not. Thanks for that tip, Marley. I'm old. I got a new laptop, and my first couple meetings, if y'all can remember, I was frustrated that my camera didn't work until someone much younger than me showed me that my camera just had a cover on it. So yeah, that was my okay boomer moment. Yeah, Cindy, you could also just log
Yeah,
out.
log out and then
Log in.
log back in.
So yeah, I didn't
while
feel
Cindy
inadequate
is-
at all when I had frustrated myself and several other people through 2 meetings because I had the lens cover on my camera. So there you go.
I will say if it is her AirPods, the only way to do it is to use the phone call in. It says you're unmuted, it says it's connected, but it never works, which is why I have these now.
There you go. Right?
So are those still Apple?
No, these ones are a Jabra headset. My friend works for them down in the Bay Area and gave me a pair because I was complaining too much. I think he was tired of hearing about it.
Jabra actually makes a good product. I've had their
Yeah.
stuff before.
Yeah, I'm generally a hardcore Apple person, but these are much better. I like them very much.
Are they wired? They're Bluetooth, right?
Yeah, they're just little Bluetooth ones, and I don't know, they fit better. I can wear them for longer without it hurting my ears, and they stay in better.
Nice.
And yeah, so
They're Android.
And they don't cost $1 bajillion.
Yeah.
Hey, we got Cindy back. Cindy,
Yeah,
can we hear
Cindy,
you?
we got you back. So
Hear me now?
Yes.
Woohoo!
Yay!
So let me please introduce Cindy Kohler. She is the Neighborhood and Community Liaison for the Neighborhood Association programs, and is the Equity and Community Engagement Officer for the City of Eugene.
Yes, kind of. Yes. And thank you for the invite. I am grateful to be here, and I really wanted to come. We have a lot of things going on at the federal level, at the local level, and I really wanted to check in with you all and see if there was any areas where I could help support you or answer any questions. I don't know that I will have any answers, but I really wanted to checking in with all the neighborhoods. So just really wanted to see how everybody's doing and if there's anything I can do to help support you in your wonderful and amazing work. So
Doriandra.
I'm sorry. I just got a call I had to do.
Oh, sorry
Tell me-
about that.
Yeah, it's okay.
We lost you. I can't hear you.
oh, you're muted. There you go.
There you go.
Okay.
So Cindy said that she's here to be supportive, to answer any questions that we may have. You know, what can she do to be supportive of us as a neighborhood association, is, you know, all of it. So I figured I would ask you first.
Yeah, thank you. That's a big question.
It is.
There's so many moving parts, and it just seems to be a roller coaster every day. So I don't really know what to even ask for in terms of support, but just knowing that we are so supported by our incredible city folks like you guys, that's a great comfort. And I think that as the days roll out here, the programs, the choices we make will all be informed by this new balance. And so I know we'll look to you guys for guidance as we sort it out. So yeah.
Julie, do you have any questions or any comments you want to make? Anybody from the board?
Well, I'd love it if Cindy could like wave her magic wand and predict the future.
That'd be great.
I think we're all sort of stuck in this holding mode now as we see with how things play out. But I appreciate you, Cindy, so much for everything that you do and working through the stress that I'm sure exists for you personally, as well as the rest of us here. So thank you. And I know that you'll do your best by us.
Thank you. Thank you. Yes.
Stephen. I can't hear you,
you're
Stephen.
muted.
Hi, Cindy. Good to see you. It's
Good to
really
see you as
good
well.
to be here in Eugene at a time like this, to be surrounded by wonderful people. I was wondering, do we yet know which city programs are most likely to be affected by cutoffs or changes in federal funding?
Yes. So changes in federal funding, we don't know because we don't know what those will look like yet. And our program isn't funded by federal funds, but we do receive some state funding for some of the work that we do. And that may that funding from the state may come from the Fed. So and that's, I don't track that. So I don't know. I don't know what will happen there. We're just kind of like a lot of folks waiting to see what happens. But with the cuts, so the mayor and council did pass the fire fee. I believe there is a group that is collecting signatures to try to put that on the ballot. We don't know what will happen. We don't know what will happen with that. So if the fire fee does not go through and we wind up with this $11.5 million or more budget gap, our program goes away, the entire program. That's equity and community engagement. That's the human rights support. That's the neighborhoods program. It's our community engagement program. All of that would go away. And I don't know would that be July 1st or would that be after an election in August or would that be in a year? I mean, I don't know. But our program is one of the top at the top of the list of things to cut if that's the way we have to go. And also the library would lose 1 or 2 days, would close for 1 or 2 days. Hours, I imagine, would be reduced. Parks maintenance was on the list for a pretty severe reduction. What else was on the list? Recreation, Amazon Pool. They may not be able to open up Amazon Pool. They may have to try to find a private vendor to take that over. If they can make that happen, then the pool would remain open under the private vendor. There was a lot. I mean, there was a lot. It was 100 and I don't remember how many jobs of folks that provide direct community service. So it's a lot. It's a lot. And even if the fire fee goes through and we get to keep those funds, there still is a gap, but it's a much smaller gap. So there's still maybe an impact to our program. Right now we have a vacancy. It's the human rights analyst who will spend about 60% of their time doing supporting the Human Rights Commission and doing some of that work, and then the rest of their time doing community engagement with the rest of our team and throughout the organization. That position may not be filled. So we're just kind of waiting right now. We're covering for that position through the staff that we currently have and hoping that we get to fill it, but we may not be able to. So no pressure.
Thanks for the rundown.
Sorry for the rundown. Yeah, we'll see what happens. So stay tuned. The budget process is still the process, and community will have an opportunity to weigh in. Those cuts are not written in stone. It's going to be, it'll come down to what the community prioritizes. And, public safety, of course, as it should be, is number one priority. And we want that to be the number one priority. But sometimes that means some of the other things go away, which also directly impacts public safety. So a lot of our services are intended to keep the community safe without the enforcement end, and eliminating those creates more pressure on public safety. So we'll see what happens. We'll just see what happens. Until then, we're all continuing to show up. We do our work. We have a deep appreciation for the community, and we'll continue plugging away.
Doriandra.
this may be a silly question, but from like, is there a simplified way to understand why our city is in such deficit financially? What?
Yeah. The city, we went through this whole process of priority programs or budgeting through it really is priority programming. So we increased a lot of programs based on feedback from the community, and a lot of it was funded with one-time funding. And we've continued to fund it with one-time funding, and now we're trying to put it incorporate it into the regular budget. And we just don't have the regular budget to support that. We've also, I mean, like everybody, the costs of doing business have dramatically increased, and the revenue has not dramatically increased. So we're trying to essentially do more with less, and it's caught up to us. So that's a lot of it. I'm not sure. I mean, we're not, when you look at personnel, we're actually, we have a smaller footprint today than we did even 10 years ago. So we've continued to reduce and shift around some of the work. A lot of people, where there were 2 people doing the work, now there's only 1, and they're trying to keep pace, which is impossible. So it's, there's just a lot of moving parts. If you get a chance, take a look at the mayor and council asked for a couple of work sessions on budget priorities, and it's budget priorities 1 and budget priorities 2, and then the third one was last was it Monday? Was this Monday? Where they actually the city councilor, or sorry, the city manager came forward with her proposals on here's what would be cut, here's what it looks like, here's where the funding goes. So take a look at those. Are all recorded. They're only 90 minutes. And like with a lot of the recordings, you can speed them up and make them at halftime. So, I mean, if you can handle the Mickey Mouse voice, they're worth watching because she goes into detail. Here's where we are. Here's how we got here. Here's where we need to be. And with all 3 presentations, she walks right through it, and there's visual aids, and she answers. Mayor and council ask really great questions. So they were all questions that I had. So the city manager and the city attorney and our budget manager answered all their questions, and they were really thoughtful with their presentation and how they presented the information. So take a look at them. It's really worth seeing and understanding kind of where we are and how we got here.
Thank you, Cindy.
Yeah.
Great suggestion.
Thank you very much. And you are very appreciated.
Thank you. So are you, all of you. Thank you.
Any other questions? For those of you, I was actually at the end, if I have an email that I need to post on the Whitaker Council page, but it talks about the fire tax, what it is, what it's going to affect, and there's also a survey on there. I assume that do you know about that, Cindy? Do they want us to post that? Is that open for the public, or was that just for the council?
Is that the email that I sent out with the survey?
No, it didn't come from you.
Then I'm not familiar. I'm not familiar with it.
Okay.
Yeah, I don't know.
Well, it explains the whole fire tax and how much it would be, and depending on whether it's like for instance, Derek, he would have a larger payment because he owns a business and he has more square feet.
Mm-hmm.
But it goes through all of that, and it also talks a lot about the library, about Amazon Pool, about basically without finding some type of funding, for me, to put it in layman's terms, we're going to lose all of our elective courses in the city. and everything that we have will be, what you have to take, English, math, algebra, all of that. The fun stuff will all go away.
Yes. And it really impacts those of lower income because, these are reduced cost services or free services. We offer a lot of scholarships. So, the impact will be felt amongst the most vulnerable in our community before it'll be felt by others. So it's, yeah.
That's good information to know and to put out there as well. That's important.
And with a fee, the fire fee for those who are low income and already, at the max of their available funds, there is 1% of that gets peeled off the top and is in an account that goes to, it's based on the eWeb's, I think it's the customer cares program, I think it is, for low income. So the fee would be waived or reduced for those who meet that criteria. So there would be, for those who are most vulnerable, the lowest income, they wouldn't be impacted by the fee. There would be some funding available to support their contributions.
Well, that's good. For me, it's $6 a month.
Right. Yeah. Yeah.
So, all right. Do we have any other questions about this? Any comments from anyone?
Just a big thank you to Cindy.
Cindy, thank you so much. And you're more than welcome to stay. We have Marley from Transponders is going to give us a presentation next.
Yeah.
And we are very excited to have you. Thank you so much for coming. And thank you for so patiently waiting and for correcting my spelling mistake as well.
No worries. It happens all the time. Transponder is one of those things that's a word that gets used in regular life. So people get confused about it. I'm going to give you sort of a short version of our normal presentation, if that's okay. Let me pull this up here. Y'all see this okay?
Yes.
Okay, great. So sorry, I'm also less familiar with Google Meet. Let's see if I can do this well. Okay, great. So I just wanted to tell you a little bit about us. We are a local nonprofit. We have a clear mission that we are a transgender founded and led nonprofit. We're based here in Eugene, but we work throughout all of Lane County as well as down in Roseburg and a little bit down in Ashland. And our main goal is to provide support, resources, and education for the transgender and gender diverse community and our allies. We started as a grassroots organization that was a community support group that started in our founder's backyard. He and his husband moved here from the Bay Area and really missed the trans community that they had built there, and so just started this little gathering group just about 12 years ago now. And it grew to be such a thing that the Pride Foundation actually reached out to them and said, we would like to help you become a 501c3 so that we can give you some money. So we went through that process, and we have now grown into quite the large organization comparatively, from something that started with no paid staff, just a group of people who needed community. We're very focused on creating healthy community within the trans and gender diverse community, and we do that through a couple of different ways that I'll tell you a little bit about. And although we primarily serve the trans and gender diverse community, most of our programs are also open to the wider queer community, and then programs like our injection supply program and our food program are open to anyone who needs those services. So we do not police people's identities when they come and want to use our supports and resources. We just feel like if they're there, they have a need, and we want to meet that. A huge part of our vision is about looking at the root causes of discrimination, and that starts at home. So part of what we do as a staff and as a board is really look at our own prejudices and our own biases and the way that we see the world and the filters that we use to make sure that we are not perpetuating the kind of discriminations that happen on a wider level throughout the country and throughout the world. So intersectionality is a huge part of what we focus on, which is really looking at, as my grandma liked to say, that it's more than the sum of its parts. When you have two or more marginalized identities, it's not just about a combination of those identities, it's an exponential impact. So that's part of what we look at. And especially right now, that means we're really putting a huge focus on the undocumented folks within our community, BIPOC folks within our community, unhoused folks within our community, because they are really being targeted and at risk far more than other parts. So a little bit about what we provide. We provide regular support groups and social groups, as well as special events. And those are for primarily, like I said, the gender diverse community, but also allies and the wider queer community. We have a vetted resource directory, and that's on our website. That is something that our data specialist and his team of volunteers and interns, they take recommendations from folks of places that are trans and queer friendly, and they call and put them through a process of answering questions so that any trans person could go on there and find a doctor and find out if they take their insurance, if they're accepting new patients, whether they have gender neutral restrooms, all sorts of things. And the whole goal is to create an easy way for trans folks to find safe places for them to go and interact within the community. And it's not just medical things. There are gyms, there are restaurants, there are all sorts of things on there. And the majority of them have been recommended by the community of being places where good experiences have happened. And so it's also part of the way that we try to support the local community and make sure that folks know who is a safe space for them. We also have our TEAS program, and that is our DEI training and consultation services. So we have two full-time trainers and educators who have developed a number of courses, and they teach schools, other nonprofits, businesses. We've done work with the county, with the city. We just finished a couple of year contract with the library. And the whole goal of it is to help folks to learn the language that they need, to learn about their own biases, about privilege, about the way that it impacts so heavily the way we all move through the world. And so, our trainer says at the heart of it, it's really all about how do I be a good person in the world? And it's harder than you would think, because there's so much that we have been trained and we have absorbed throughout our lives. And so it's a really wonderful program that is based on a safe and fun atmosphere to unpack a lot of the things that we have. It's a non-judgmental program, and people who go through it really love it and really feel like they come out of it with a lot of new information and a lot of new training to just feel more confident in their interactions in the world and know that they are doing the least amount of harm possible. So we're very, very proud of that program. We also offer free gender affirming products. We have a closet called Sylvia's Closet, and that is in combination with Queer Eugene and their clothing closets. So anybody can come and get free clothing, free shoes, free gender affirming products. So that's things like binders, scar tape for after surgery. We have bras and bra forms. We have makeup, magnetic eyelashes, all sorts of things. And it's really geared towards helping people to get the things that they need to live authentically and to live the way that they need to see themselves that way. Many of these products are very expensive, and you don't always know which ones you're going to like and which ones are going to fit right. And so we also offer a chance for folks to learn how to use some of these products safely and well, and there are low barriers for that. And then anything that we don't carry, we work with As You Like It, both here and in Ashland, to do a voucher program. So folks can come in and we give them a voucher that they can then take and purchase the products that they need. And the As You Like It staff has training from us as well, and does a really great job with that. And that also offers a little bit of resources down in Southern Oregon, where there are very little resources for the trans community. One of our most popular programs is our Legal ID Change Financial Assistance Program, as well as navigation support, especially right now. That is the thing that has upticked the very most. And so I don't know if anybody has gone through a legal name change, but the initial process is not too bad, but then it's changing your social security card, getting a copy of your birth certificate, doing all of these different things. And, you know, all along the way, you're having to pay for things and you're having to navigate all through it. So we have a resource navigation manager whose entire job is to help people navigate whatever it is they need, whether that's getting on OHP, whether it's getting housing assistance, whether it's getting a name change. Their whole job is to help somebody within the community know how to do that and have somebody to walk with them through that process and give them the confidence they need. And that's especially important when we also have folks who are coming from a non-English speaking background, and there's a lot of legalese, there's a lot of bureaucracy that can be very confusing. So our resource navigator is a huge asset for that. And then we also offer behavioral health services, which we have a peer support specialist who is a trans person. And so that's really, really key for those peer support sessions, is having that lived experience, meeting in a common ground. And they offer mental health support, they offer substance use support, as well as just kind of somebody to make people feel seen and understood and heard. So the behavioral health services are continuing to grow. Our eventual goal is to have a clinic where we would offer gender affirming care in-house. Right now, we are able to offer a certain amount of it, but not to the level that we would like to get. So that's one of our long-term goals. But it's built quite a bit over the past couple of years. This is just a little graphic about the community that we serve. So over 40% of our community is on a low income. Over 70% use queer as a descriptor. 75% are living with some form of disability. And then we have sort of a pronoun breakdown here. The about half of our population use they, them pronouns. And then we have a little population that is steadily growing that use what we call neo pronouns, which are new ones, which even for those of us within the community gets confusing at times. And I have an intern right now that uses vi, vis, vers neo pronouns, which are new to me. And so constantly I have to be reminded about it, and it's a great learning experience. But this is something that you know, the pronoun conversation nationwide has been a big deal, and so we're always interested in how the community feels about it. And for the majority of us within the community use multiple pronouns. So I use both she and they pronouns, and I'm fine with either of them. And more we're finding that a younger generation is sort of like, I don't care, any of them are fine. But it's something that really does make a difference when people ask about them and respect them and try. Mostly it's the effort that seems to make a big difference. So some of the clubs, classes, and social hours that we offer, we have a weekly book club that meets on Tuesday evenings. That's a virtual book club. They have met for, let me see now, just about 8 years. And they went virtual when COVID happened, and then voted to stay virtual because they had gotten members from around the world that joined. So they have folks that are a huge part of this community and absolutely love it. It's an all ages group. Ben, who is our program director, runs this group, and they quite often have teenagers all the way through 80-year-old folks in the group. So it's a really great intergenerational group. And he likes to say that it's a book club, and they sometimes talk about books. And more than anything, it is just a space where they can kind of talk about whatever's going on in their lives, and then also talk about whatever book they've picked for the month. And they do exclusively books about trans and gender diverse folks or written by trans and gender diverse folks, and have a great list of books that they've done. We have a gender diverse yoga class that meets at the Sheldon Community Center. That one is both in person, and then there's also a Google Meet link for folks that either can't make it or are uncomfortable being there in person, which is really great. The We Us Ours social hour is really just a space for trans and queer folks to come in and be in community together. And then this one, the trans and ally social hour, is very similar, but in a coffee shop instead of a bar, to make sure that we have options for everybody. And then we have our support groups. We have a QT BIPOC group, so that's queer, trans, and BIPOC, and they meet once a month. We've got the trans community support group. This is the group that started it all. They meet twice a month, once in person and once on Google Meet. Queer, Trans, and Disability meets virtually. They meet weekly, and that's a really big group. There's about 40 people that meet regularly each week in that group. And then our Transparent group is a space for parents of trans folks, and they have folks in that group that are parents of adult trans people that have come out, kids. It really runs the gamut, and it's a great opportunity for people to I always like to tell parents when their kids come out that they will have processing to do and they have to do that on their own time, that it's not something for them to do with their child who has just come out to them. And so this is a great space to be able to do that, to ask folks who have already gone through what they're going through. And a lot of the conversation, as you can imagine right now, is the fear of being a parent of a child who is at risk right now. And this used to meet just once a month, and then it got big enough and was in such demand that it meets twice a month now. And the in-person one, they are also working on getting childcare so that folks can bring their kids and still have this space to meet. And so, and little side note, we did just receive a grant that is going to allow us to start a youth program. And so that's one of our hopes, is to be able to offer like a youth space for queer and trans kids to meet while this meeting is going on as well. And all of our clubs, classes, support groups, those are all free always. And the only like barrier that we have is our virtual ones. You do have to do a screening just to make sure that you are not an internet troll, because we have had some issues with that over the past year or so. But other than that, it's as low barrier as it possibly could be. We also do a number of special events. These pictures are from our cozy sweater party that we had this past December. We had Drag Santa and Mrs. Claus, and we had the Grinch wandering around. We painted ornaments and had a s'mores fire pit going on in the courtyard. We had a drag show and karaoke, and it was really just a wonderful night of community. We are sort of new to this style of event. In the past, we've done like a big gala and mostly like little support group meetings here and there. But we made a shift last year and wanted to commit more to focusing on community as healthcare, and recognizing that one of the huge risks for our community is isolation and loneliness. And so we decided to throw a party in December, and we expected about 40 people, and we had over 150 people come to the event, and just had a really great time. So we have a bunch of events this year coming up. At the end of March, we'll be having the last day of March is Transgender Day of Visibility, if folks don't know, and we are doing a gallery space. We're located on Maxwell as part of the Lavender Network, like Amanda was talking about with HIV Alliance. It's in an old church building, and we're turning the whole building into a gallery space for queer and trans artists. So we'll have a little reception, we'll have some spoken word performances and some drag performances, and a chance for people to go through and look at the art and purchase the art as well. Then we're having our third Trans Wild Forest Frolic this year. This says May, it's actually been moved to April. This is something that we have done for a couple years now with Cascadia Wildlands and Mount Pisgah. So it's at Mount Pisgah, and it's focused on creating space for marginalized communities to have access to nature. Because if any of you like to go hiking, if you think about your own hiking experiences and you pass people on the trail and there's kind of this cool hiking culture, but if you think about what that is like as a trans person, not knowing if you will be safe to be grungy and be sweaty and be yourself on the trail, not knowing what those experiences are going to be like. And the same for BIPOC folk. And it's not always the most welcoming community for marginalized folks. And so this aims to change that. We're going to host a Pride Prom this year. This is really just something that we're hoping to allow those of us that didn't get to go to prom as ourselves a chance to do it again. Pride in the Park is a big one. We're going to do a film festival with Art House Eugene. So this will be a little 3-day festival that's focused on movies centered around trans stories. We'll have a Pride Pumpkin Patch also at the Lavender Network, which is again focused on safe spaces for queer and trans families to have those kind of holiday experiences. Again, as you might imagine, it's not always easy as a visibly queer, visibly trans family to go to a farm and have this pumpkin patch experience. And so, as a parent, our number one priority is keeping our kids safe. And so sometimes we just don't go do the things because we don't know if it'll be safe or not. And so this is focused on creating a space that we know will be safe for them. In November is Transgender Day of Remembrance. We have a service each year where we read the names of all of the trans folks that died from trans-related violence through the year. And then we're going to do the Cozy Sweater Party again at the end of the year. And then throughout the year, we also have testing clinics. We've got other community events, different fundraisers, all sorts of things, queer community days and whatnot. This is one of our big programs. We run a free food program every Thursday at our space. This is in conjunction with Food for Lane County. So we go and pick up just truckloads of food and put it out there and have, we pretty regularly have about 200 people come through each week to get food. And it's a really amazing program. And again, it's not restricted to, you don't have to be trans or queer to participate in this. It's for anybody who needs it. It is, as far as we are aware, it is the only free food program in the Santa Clara area. And so that has been a benefit to being in our new location. The downside is it is hard to reach our location via public transit. So that's something that we're working on. Yeah.
Right. Just so that you know, I read today that LTD just agreed to send a bus over there.
That's amazing. I love to hear
sorry
that.
to interrupt you, but I've been following and reading
No,
about
that's
getting
great.
there.
We talk about it weekly, and you know we know the difficulties around it, but yeah, more access would be amazing. So this was our Halloween food program. It happened to fall on Halloween, which was very, very fun to see the families come out and the kids in costume and whatnot. So so it's a really great program that we're really proud of. And then this is a new program that we just launched last year. This was from a grant that we received from Trillium, and it's our job skills program. And the purpose of this was to address the inequity for trans folks in finding steady employment. And so in addition to giving just like basic interview skills, how to build a resume, those kinds of things, we have employment navigation. We have a full-time program manager who helps with searching for jobs, helps with doing assessments of skills to see what jobs would be a good match. We do monthly skill building workshops with everything from, you know, how to dress professionally for the workplace to how to build credit, just all, you know, how to set a personal budget, all sorts of things. We also have financial assistance for things like interview clothing and professional clothing, specifically gender affirming clothing. And then the biggest part of it is we have paid internship opportunities. We have 12 internships that are in a transponder with a variety of different departments. Right now, I have 3 interns, and they're 3-month-long internships, 20 hours a week, and you get paid $15 an hour. And the goal of them is really to give folks lived experience working in a safe place that they know is safe for them, where they can get constructive feedback. And it has been such a beneficial program, not just for the interns, but for us as a staff. We currently only have 12 staff, and then we have 12 interns, so they double our abilities. And I have just been so impressed with the way we've seen some of these interns grow and seen them move into industries that they're interested in. And it's just been really an incredible program to be a part of and witness. And these are just some of our interns at different events here. So it's been a really great program, and it will continue through the end of the year. We're sort of developing right now what it's going to look like if we're going to continue to. We don't have funding lined up yet. We're hoping to get some more funding, and then hoping to maybe develop a next step program that would be longer internships at a little bit of a higher wage, that would be more specific, more skill building. So we'll kind of see where it goes from there, but it's been a great program. And then behavioral health services, like I said, resource navigation. We do have an injection supply program, much like HIV Alliance's needle exchange program. It's very similar to that. We have Sharps containers. We get people the supplies that they need, and we do weekly deliveries for that as well. So you can sign up on our website if you need those things delivered, and we have a delivery driver who makes all of those deliveries. And that's in the Eugene Springfield area. And we just received funding, so in a couple of months we'll be able to launch, and they will be making deliveries in Roseburg as well. So that'll be basically the whole I-5 corridor between Eugene and Roseburg will be able to service with that. And then, like I said, we've got peer support specialist as well to help with that. And soon we will have a youth support specialist as well, which will specifically be for folks 14 through 24. And then some information about how you get a hold of us. Like I said, we're on Maxwell, and we're there 4 days a week. We have Fridays we're closed to allow our staff to get some things done without constantly being front public facing. But we are open by appointments if Fridays are the days that people need to be there. So yeah, that's a little bit about us. And I'm happy to answer any questions that folks might have.
Fantastic. Wow, so much going on. You must be very busy, very busy.
Yes, we are very busy. I will note we just we had our monthly staff meeting yesterday and realized that in the next 4 months we are hiring 7 new positions, and only one of them is for services we're not already doing. So we're realizing how much our staff has been holding on. When I started 2 years ago, there were only 2 paid staff members, and so we have grown considerably in the past couple of years, and the need continues. So we're showing up every day and you know, putting one foot in front of the other and just making sure we can meet the needs of the people who are in front of us.
Great. Do we have any questions or anything we want to say? Briandra?
Yeah, it seems like the elephant in the room question, really, but like, how are y'all staying so positive right now when like you're doing a great job? Like, but like, how are you handling all of this negativity going around?
Yeah, you know, it's funny because I think humor, it has been the main way as a staff that we're kind of staying sane. We're all figuring out what are the things that are keeping us going. We were kind of chatting about it during staff meeting yesterday. We had an impromptu potluck yesterday with all of us. So I think we're all aware of how important community is right now, and that even those of us who have steady employment, you know, are secure in our housing, we have all of these, and we work in an environment where we can be who we are and we feel safe and all of that. We're still anxious and we're still feeling lonely and distanced, and so that need to come together is so strong. So I think you know, we were joking about how we're going vacillating wildly between overwhelm and disassociation, and trying to find a balance, but I think there is something to having moments where we just are like, we're going to forget about this right now. We're going to do this thing that brings us joy. We're going to, you know, hang out with the people that we love, and just keep trying to find the balance of taking care of ourselves as folks and taking care of our community. And people are scared. We're scared as staff members, but the community is very scared. I think it's all we really can do is kind of look at like, okay, what does next week offer us? What does next month offer us? And just keep trying to help the person who's right there in front of us, and recognizing that this person was able to show up, and that means there's tens more people that weren't able to show up. And so what are we doing for them? So it's a day-to-day situation, to be totally honest. I'm really enjoying listening to punk music a lot. That's helping me out. But I think it does really help to know that the community of the other staff members are there. And I think that has been the feedback we've gotten from our participants as well, is that knowing that transponder is there, that they can come, and we have seen more people just show up to kind of hang out. We have a free library at the space, and we've seen more people come and check books out. And I think there's something to just wanting to be with other people that, you know, get you and love you, and to help feel safe in that way. I mean, the upside as the development director is that we have seen an upswing in donations, which is very helpful, because, you know, one of the big anxieties is, will we still have funding? And a good deal of our behavioral health funding is state funding that is channeled through from federal funding. So we are definitely in that space of going, okay, well, we hope that we'll continue to have this, but I think I always think of the analogy of what I heard about choirs, of how not everybody holds the note at the same time, but people stagger so that then you still have this rich sound. And I think that's what we're trying to do as a staff, is be honest with each other of like, hey, I need a day, or I can't do that. I don't have the spoons for this right now. And I think that we've especially our ED has created a really good environment for that, to feel safe, to be like, I just can't today, and knowing that everybody is going to kind of rally around, and everybody's going to give the 100% when they can, and they're going to do their best with what their best is in the moment, and that's going to be all right. So that has been really helpful.
Bravo. That's a great snapshot of and inspiring. We gotta follow this, Margaret. We gotta
That's right.
We gotta get pumped and happy and
Yeah, you got to keep showing up, right? It
Yeah.
makes a big difference.
Yeah.
And I will say that from our community's perspective, when we see allies showing up, it does make a big difference, because more than anything, it becomes easy to feel like there isn't anybody that cares about this, because there's so much to care about. Nobody can be talking about all of it all the time. And so those moments where people are showing up and saying like, no, this community is important, we care about them, they're here, they've always been here, they matter. It makes a big difference, because it can feel draining and feel like we're going to do it all for ourselves. And so when those allies show up, when the rest of the queer community shows up, it really does bolster and bring the hope that's necessary.
Fantastic.
Thank you.
I think that's Stephen.
I'd just like to say to Marley that it is painful to hear the cruelty that's coming from Washington, D.C. on a steady basis, and assuring that the Whitaker are definitely allies. So we are a community of allies, and thank you for coming this evening.
Thank you. I appreciate that. And I will say that I think even, I mean, everybody, I'm relatively Eugene. I moved up here like 6.5 years ago. And from the beginning, I just kept hearing people talk about the Whitaker, and I'm like, I don't know what this is that you're saying. But I think it's very clear within the community that that is a space that feels safe. You know, that there are businesses there that are super supportive, that is a space that you can exist without a lot of fear. There's always the normal amount of fear that just kind of lives within you, but I think that is definitely a neighborhood. So I think you all are doing a good job with that.
Thank you very much. Julie, did you have a question? Thank you, Chris.
Thanks, Chris. It was good to see you and Latifah. No, just to express, Marley, I really enjoyed you as a speaker. Thank you for a great presentation. I hope that you'll come back and talk to the WCC more. It seems like we are really aligned in a lot of our efforts and goals, and also close in location too. So I thought this was great. I appreciate your time.
Thank you. No, I appreciate that. Yeah, I would love to do more collaborative things, and you know, we're always looking for stuff that we can do in the neighborhood. And I will say we are looking for a secondary office location, because we're bringing on so much staff. So if you know of an area that has office space available, let us know, because we're always looking for that. And then I would just invite you all to know that, like, these are community events that we do. We really love to have allies there. So I know that sometimes allies can feel like they don't want to take space away from the community, but these really are meant to be community-driven events, so that it is allies coming into a queer and trans space by invitation, to come be a part of our community too. So you know, I hope you'll think about following us on social media, coming to some of those events and participating, because you know, they're actually like a lot of fun to be a part of.
Well, thank you so much. Jen, did you have something you wanted to say?
Just really quick, the market does a really, really fun Pride celebration, usually at the end of July or August. We haven't done the schedule yet this year, but hopefully Transponder can come out and table or share information. We'd love to party with y'all.
Yeah, we would love that. Yeah, as the leader of the outreach team, I'm always looking for like what are going to be the priority things, and those Pride festivals are. I think there was one last year, and it happened to be like on a day that we already had another thing happening. So we have it on our list already of like, find out when this is happening. So we would love to do that.
Fantastic. It's been wonderful. Your presentation was fantastic. Thank you so much, and thank you for all the work that you're doing. Do we have any other questions? So, Marley, you can stay and hang out with us till we're done. You can go, whatever works best for you. We're just going to get a real quick update. I was watching the news today and I saw, HIV Alliance on the news, and everybody's talking about nonprofits and about what's happening with money. And I will tell you that the first day that they said they were closing down all the money, and that the feds were not, they're just shutting the doors and turning it off, Doriandra and I got together and we ended up down at Cindy's office. And so we talked to them a little bit. Thank you, Marley. You have a good night. We ended up at Cindy's office and had a meeting with them. And then, as we all know, every day things are changing. Every day it's something else. And so come to find out, we did a little research and some of our money is federal. Yes, but we're still waiting to find out about that. But Doriandra has some fantastic news that most of you already know. So Doriandra, why don't you take the floor with that real quick? I know you're not feeling great.
Sure. Yeah, we are, I think, just a couple more steps away from launching the Healthy Homes Grant. So it's been a real tough one to get off the ground, but we had an excellent public health and safety meeting last night. Jen and Stephen and Joanna, Janet, a lot of folks were on, and we really talked through the policies that we've got to tighten up, and the application is just about ready to go live. So we'll be launching that really soon. It's going to be a great project. And the other thing is just a quick shout out tonight about the ice storm coming. Just a quick reminder, and let your friends and folks know the Whitaker Connects, the fiber optic Wi-Fi hubs are turned on as of tonight. So if we lose power, just remember to make your way over to either the parking lot at Bruns Apple Market or over by the Eugene Mission. It's in the parking lot where we have our meetings. So you can just take a bike or walk over there and log on. Maybe before power comes out, you might want to jump on our social media and take a little picture of the Wi-Fi hub card that says how to log on and everything. I put it in the chat, but this Google Meets can't take the PDF or JPEG. So we love Google Meets. So yeah, good stuff happening, and just stay safe out there, and hopefully this won't be an incredible storm, but if it does, let's use that Wi-Fi stuff. Let's play with it.
Fantastic. All right. And that's it's very exciting to know that we still have that grant. I do have a quick question for you, Cindy. Since Google has decided to make some changes that are not necessarily the best, they also I read took out their it was in their bylaws that they wouldn't be part of any weapons, spying on people, that kind of stuff. They took all of that out of their company. So they're pretty much just following the leader at this point. Is the city of Eugene going to continue to support that type of company?
Yeah, I don't know, because this is all still new. So I don't know.
Maybe you could ask someone that for me, because
yeah, I will.
I know people that work at Costco, and they said, don't believe what anyone tells you. Our membership is blowing through the door because they've refused to change anything that they do. And it's working. It's better for them.
Yeah.
So, we can't believe anything that we read on social media, really. I watched a video where some guy from, I don't remember where he was from. He was a senator, and he was holding a phone, and he was talking to somebody from Google. And he said, is Google going to know when I go sit over there by Joe Schmo? is Google going to know that I got up and moved and went over there? And the guy's like, well, I don't know. He wouldn't answer the question. So it was yes, was the answer.
Yeah, your
But-
cell phone knows where you are. There's programs out there that track your cell phone. I mean, it's not like, oh, here's Margaret going from point A to point B. It's like, here's all the cell phones that are in this area traveling from this area to that area. So
Right,
I
but
mean,
Google does it
we're being tracked.
specifically as well.
Yeah, doesn't surprise me in the slightest.
Yeah.
Yeah.
Okay. Do we have
Yeah.
anything else? Cindy, thank you so much for coming.
Thank you.
Just so that you know, Susan, when is your show?
The opening is the show is up right now at Hybrid, Anatomy of Love, and the opening party with music and a food cart and all kinds of things is happening Friday the 14th, starting at 5 until 8 o'clock. So, and
Fantastic.
there's other local artists in the show, lots of local artists. And
The show looks great. I saw some of it.
I also wanted to just circle back briefly to what Doriander said about there was a PDF with some information. Did you say it's in the chat? And I could not find what you were talking about.
Sorry, Susan. Yeah. So WCC, we've got a little information card, and unfortunately I can't get it into this Google Meets chat. So
Is it on the website?
Yeah, I was suggesting if you look at our social media page
okay.
or the Open Neighbors, it will be there. And if you just take a snapshot of it, you'll have your login information for either the mission or the market.
Okay, thank you.
Yeah.
Thank you very much, and good luck with your show.
Yeah.
Yeah, I'm sure it will be fantastic. I'm kind of laying low. I probably half the people I know are sick.
Mm-hmm.
So
okay.
Yeah.
I am not sick at this
Good.
moment.
Good. And Julie, did we get all the attendance?
To be honest, I don't know if I can look at who filled out that general meeting attendance form live or if it's something that comes to me later. But yes, I
Okay.
got everyone who was listed in the chat.
We did. So, and you got Jen and
You got Jen, Cynthia. Cynthia, your husband's name is Mark?
Yeah, yes.
And their last name? What's Mark's last name?
Gotts.
The same, yes. I'm certain that I met you in person at one of our previous meetings, and since you only have to attend one meeting to have status to vote, you're already on that list. But I'll make sure both of you are there.
We were at the
Right,
meeting at the
and-
mission.
Yeah.
I'm sorry.
We were at the last meeting at the mission.
Yep. Cynthia
Right.
came and played bingo. I remember now.
Oh, yeah.
Pizza.
Remember you guys. too.
Yeah, and we will have our March meeting, and then April is the election. And Cindy has been kind enough to offer to come and count votes for us.
Thank you.
So please, everyone, come and vote, run. There's lots of fun to be had, and the truth is I can't think of a time in my life where we were not in more need of community.
Very true.
It really is. It's so true. So thank you very much. Anyone else have anything they want to say? I think we're going to sign out a little bit early. Jen, we'll see you soon. And next month we will be at the mission again. Okay. Thank you all very much. And
Have a good
Miranda, I will
night.
talk to you later.
Thank you.
Yep. Night.
Bye. Thank you.